Hi, so like I said the other day, I was going to do a separate video on diabetes. I come from a community where the healthcare disparity is like huge. People are not always fortunate enough to have access to healthcare because, first of all, it's scarce. And secondly, when it's available, it's not always affordable, right? Diabetes is something that often is not diagnosed early and then often is not treated properly. Backstory, I had a friend of mine whose mother died from complications of diabetes because her blood sugars were elevated and there was no insulin around in the hospital in that area in the city. So diabetes is something that is becoming more common, becoming more diagnosed, I would say, compared to like 5, 10 years ago, 15 years ago. And there's certain subtle signs that you can have that would kind of tell you that you might be diabetic, right? We have things like the 3 Ps, the polyphagia, polyuria, polydipsia. Means that you're hungry often, you pee a lot, and you are thirsty. You drink a lot of water, right? There are also signs like, you're feeling weak and tired when your sugars drop. When your sugars are high, there comes like confusion, like people are like dizzy, drowsy, not really sure. And this is like type 2 diabetes, especially. Type 1 diabetes is like autoimmune, so I'm not really going to talk about that. I'm not a physician, so my knowledge base is this much. I'm still trying to study. But that's like an autoimmune condition, the type 1 diabetics, and it's often diagnosed before the age of 30. Type 2 diabetes, however, is what's rampant now, especially like with the younger children. We're realizing that little kids are becoming obese and diabetic, and it's something that we really need to put a handle on it, right? So this is a list of symptoms of diabetes. I got this from the CDC.gov website. Like I talked about earlier, there is increased urination, especially at night. People are often very thirsty. They lose weight without trying. They're very hungry, have blurry vision, have numb and tingly hands and feet, feel very tired, have very dry skin, have sores that heal slowly, and have more infections than usual. So there are certain tests that I use to screen for diabetes. We have the fasting blood glucose that is greater than 100. So if it's like 99 and above, it's considered diabetes or pre-diabetic. If you have a random blood glucose of 126, and if you have a hemoglobin A1C, which is greater than 6.5, is considered diabetes, right? So again, you have to go to the doctor, you have to have blood work done, you have to have numbers to be able to diagnose yourself with diabetes. Then again, like I said, the task force here would want us to. So after going to the primary care provider and getting lab work done, what classifies you as being diabetic? If you have an A1C level that is above 6.5, it gives you an average of your blood sugar over the last 3 months. If it's greater than 6.5, then you're diabetic. If you have a fasting blood glucose that is greater than 126, if you have a random blood glucose, especially if you're symptomatic, that's greater than or equal to 200, and you have a glucose tolerance test that comes back at greater than 200, then you're diabetic. What puts us at risk for diabetes? We're 80% what we eat and 20% are our parents, right? I like that saying a lot. I don't know why. So if you have a lipid panel, lipid levels that are off, like just out of whack, if your good cholesterol, your HDL is less than 35, if your triglyceride levels are greater than 250, if you have a first degree relative that has diabetes, like your mom, your dad, it puts you at risk for diabetes. If you're African, right? African American, Native Americans, and for women that had gestational diabetes or that gave birth to a baby that weighed over 9 pounds, that puts you at risk for diabetes as well. So how do we prevent diabetes, right? TLC, therapeutic lifestyle changes. Exercising 40 minutes a day, 3 times a week has shown to improve mood, decrease your triglyceride levels, help bring your HDL, the good cholesterol levels up. Eating less fatty foods, really, like low density lipoproteins are like the killer, right? We should try to avoid the foods that come especially from animals. And I say animals, I mean like beef, I mean chicken, I mean fish, I mean shrimp. Anything that comes from an animal has like high cholesterol, high triglycerides. Like it's just bad for us, right? Also, if you eat less salt, manage your blood pressures, obstructive sleep apnea, like all those underlying health problems that kind of impedes our health, like little at a time would predispose us for other things to happen. Exercise. I know we work from home, we work at office desks. Some people work like in a like sedentary, like they sit and work. Try to get up, try to get out in the sun, try to be as active as you can. Just try to do your part to bring those numbers down, right? Let's all fight diabetes. Let's fight it. Some complications that result from uncontrolled diabetes are like microvascular changes in the kidneys, the neural system, neurological system, and the eyes, right? Called diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. So you have like changes in your vision, so you have to get screened every year. We also have like complications that affect the big vessels, like vessels of the heart. People have like strokes, peripheral artery disease from poor circulation. People also have poor wound healing when they're diabetic. They have decreased resistance to infections, and also pregnancy and birth complications result from being diabetic. We can prevent diabetes with our lifestyle changes, TLC. Those are my 2 cents, okay?